Hi, Assalamualaikum. We are from Group 3. We will present about the total hip replacement. Our group contains Danish Farhan, Muhammad Haris Kushari, Angzime, and the last one is Nurindayan.
Assalamualaikum warahmatullahi wabarakatuh. My name is Danish Farhan bin Shahruddin. My nometry is 2411544051. Today, I will present to you the factor for the failure for total hip replacement. First, we have the mechanical factors. Over time, the polyethylene linear in the hip joint wears down, creating tiny debris particles. These particles trigger inflammation, leading to the bone loss, a condition called osteolysis. Another issue is metal-on-metal implant, which can release toxic ion, causing tissue damage or even pseudotumors. Additionally, if the implant doesn't bond well with the bone, a problem called septic loosening, or if stress, shielding occurs where the bond weakens due to uneven load distribution. The implant can become unstable. Second, we have the biological factors. Infection, known as peristaltic joint infection or PJI, are a major concern. Bacteria can form biofilms on implant, leading to the chronic inflammation. Patients with diabetes or obesity are at a higher risk. Another issue is the body immune response. Some patients are allergic to the metals like nickels and cobalt chrome alloys, and where debris can cause long-term inflammation. Also, we have the surgical patient factors. If the acetabular cup is misaligned by even a few degrees, it can lead to dislocation. Pure cementing technique in the cemented stance can also cause failure. On the patient side, high activity levels accelerate wear, while obesity or osteoporosis can compromise bone quality, making fixation harder. Then, material-specific failures. Material themselves can fail. Ceramic femoral heads, while durable, can fracture categorically in a rare case. Modular components with metal junctions may corrode over time due to fretting or gradual corrosion.
Hi, my name is Muhammad Haris Kushari bin Ismail. My metric number is 2411544098. I will describe three biomaterial approach to prevent total hip replacement failure. For the first point, we can improve bearing surface material for wear-resistant material. One of the main reasons for hip replacement failure is wear and tear of the joint surface. Using highly cross-lined polyethylene, or we can call HLPE, ceramic on ceramic or ceramic on polyethylene. Bearing surface reduce the generation of wear particles, which are a major cause of inflammation and implant loosening. For the reason is if we can lower the wear rate, then the fewer debris particle, then we can reduce risk of aseptic loosening. For a second point, we can advance bioactive coating for implant by apply bioactive coating such as hydroxyapatite, titanium plasma spray, or titanium based coating can promote bone growth onto the implant, exchanging fixation and reducing loosening. The reason is by exchange bonding between the bone and implant, then we can stronger or longer lasting integration. For the last point, we have antibacterial surface modification. Infection are a significant cause of early THR failure. Biomaterial can be modified to release antibiotic or be coated with silver nanoparticles, cytosan or other antimicrobial agent to prevent bacterial adhesion and biofilm formation. The reason is reduce if we reduce risk of post-seasonal infection, we can lower the chance of revision surgery.
Good morning, doctor. My name is Anzume, and today I will be presenting the biological evaluation of a total hip replacement based on the ISO 10993-1 standard. This standard is part of the overall risk management process for medical device, and it provides clear guidelines to help ensure that implants, like the total hip replacement, are safe and biocompatible when used in the human body. Because hip implants are designed to stay in the body for more than 30 days. They are classified as long-term implants. They also have direct contact with bone and tissue, which increase the need for careful biological testing. Next, under ISO 10993-1, we follow a risk-based approach. This means the type of test we conduct depends on where the implant is placed in the body and how long it stays there. The main goal is to identify any potential biological hazard and make sure they can be properly managed before the implant is used in a patient. Several biological tests are required for hip replacement. First, cytotoxicity testing is performed to determine if the material used can damage or kill surrounding cells. Next, sensitization and irritation tests help detect if the implants might cause allergic reactions or skin irritations. We also carry out systemic toxicity and subchronic toxicity tests to study how the whole body might respond to the material over time. For long-term safety, genotoxicity testing is conducted to check whether the material could cause genetic damage or mutations. All of these evaluations help us ensure that the hip implant is not only effective but also safe, stable, and biocompatible for long-term use. This process also supports the overall goal of protecting patient health by minimizing biological risk before the implant is approved for clinical use. ISO 10993-1 is like a safety checklist for developer, engineer, and manufacturer to follow so that we can confidently say that the implants won't harm the body, especially during long-term exposure. That's all for me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurindayana binti Hisham. My number is 241154172. I am the last presenter of this video, and I would like to tell you guys about the main components of total hip replacement proposal and design consideration as a junior biomedical engineers. So, if you guys would like to know about the components and the design consideration, so stay tuned. Okay, before we start, did you guys know why we need total hip replacement? Or we call as total hip arthroplasty. Okay, the total hip replacement is needed when the hip joint is severely damaged or diseased that we know as the osteoarthritis, rheumatoid arthritis, avascular necrosis, or the last one is hip fracture. If I am the junior biomedical engineer, today I would like to present and propose my design for a total hip replacement system. And the presentation will cover the main components and the implant, and also the key consideration, which include the chemical, morphological, and mechanical properties of the biomaterials used. So the first one, as you guys know, the total hip replacement got the three major components, which call as acetabular cup, femoral head, and femoral stem. So let us go first for the acetabular cup. In this part, as we know, the hip is ball and socket joint. So acetabular cup is the part replace the natural hip socket and typically includes the metal outer shell that made of the titanium alloy or cobalt chromium for the strength and biocompatibility. So the inside line with the ultra high molecular weight polyethylene UHMWPE or ceramic, which acts as the bearing surface to reduce the friction and the femoral head. For the next part is femoral head. This is the ball part of the joint and replacing the head of the femur. So it is made from ceramic materials like alumina, zirconia, or metal alloys such as cobalt chromium. So the ceramics are preferred for younger patients due to their excellent wear resistance and low friction properties. So the last major component is femoral stem. The femoral stem is to inserted into the femur to support the femoral head. The stem is often made from the titanium alloys or cobalt chromium for their lower elastic modulus, which helps reduce stress shielding. So the surface of the stem may be coated with the porous titanium or hydroxyapatite HA to encourage the bone integration. I will continue for the properties of the design consideration of total hip replacement after this. Thank you. Now let's take a look at the chemical design consideration. First, corrosion resistance is critical. The materials must not degrade in the body fluids over time. Both titaniums and cobalt chromium alloys form protective outside layers, making them highly stable inside the body. The second one is the material must be biocompatible, meaning they should not cause any toxic allergic reaction or any adverse reaction. For example, ceramics are chemically inert, while titanium is non-toxic and integrates well with wood. The third point is we avoid materials release harmful metal ions such as nickel unless carefully controlled through surface treatments. Now let's move to morphology properties. Morphology refers to the structure and shape of the implant surface. Surface texture is very important. For example, a rough or porous surface on the femoral stem allows for the osseointegration. This means that bone can grow directly onto the implant and increasing the stability. Some of implants are coated with the hydroxyapatite HA, which is a natural bone mineral to enhance bonding. Also, the design must consider the anatomical shape of the human hip. Modern implants are designed using 3D imaging and modeling to match the patient's bones geometry. Modular design are also common, allowing surgeons to adjust the head size and neck angle during surgery for better joint function. The last one is mechanical properties. The mechanical performance of the implant is one of the most important aspects. High strength and fatigue resistance are needed because the hip joint bears the body weight and goes through the millions of movement cycle. Materials like cobalt chromium and titanium alloys offer great mechanical strength and resist from wear and tear. Another key factor is elastic modulus, the stiffness of the materials. Titanium's lowest modulus is closer to depth of bone, which help to prevent stress shielding. Stress shielding happens when the implant is too stiff and the surrounding bone becomes weaker and the lack of stress. The wear resistance of the femoral head and acetabular liner is also crucial. Using the ceramic on polyethylene or ceramic on ceramic combination reduces wear particles, which help to prevent inflammation or implant loosening. As the conclusion, a successful total hip replacement must combine strong and biocompatible materials like titanium, ceramics, and polyethylene, smart surface design that encourage the bone bonding, and mechanical properties that match the natural function of the hip. As junior biomedical engineers, our role is to ensure that the implant performs well inside the body, lasts for many years, and most importantly, helps the patient to return to a pain-free, mobile, and active life. So that's all from me. So that's all from me in the last part of this video. Thank you.